Hello, my name is Victoria Wilson, and I will be presenting my project, How Different Forms of Communication Mediate the Alleviation of Pediatric Dental Anxiety. The purpose of my project was to investigate genres of dental writing in a way that identifies their role in alleviating pediatric dental anxiety. I also wanted to understand how aspects of these genres are altered to fit the specific situations with varying patients. Overall, the goal of my research was to determine how multiple forms of communication are used collectively to create the best experience for pediatric patients and their families. The goal of this assignment was to explore an area of genuine inquiry by personally adding to a conversation of previous research. Throughout this semester-long process, I conducted secondary research in both genre studies and in pediatric dentistry. Regarding pediatric dentistry, I focused my research mainly on articles discussing communication methods and dental anxiety. After completing my secondary research, I began searching for participants, pediatric dentists. Once I found each of my participants, to whom I provided a consent form, I asked for copies of the dental forms they use in their office. After collecting each of the forms, I began analyzing them with the genre analysis questions I had created. By analyzing these forms first, I was able to develop a good understanding of them before my interviews with the dentists. This allowed me to create interview questions that were specific and beneficial to my research. I then conducted my interviews and coded my data before writing up my results. I would also like to note that I completed CTI training before collecting any data, and I kept any personal information of the subjects or their dental practice confidential. Throughout my investigation, I found that verbal, nonverbal, and written forms of communication work together in a dental setting to alleviate pediatric dental anxiety. Each of my participants explained how parents rarely read forms in their entirety or at all. This was interesting to me because I also found that the information on some of these forms directly correlates to the communication methods the dentist will use with that patient. For example, if a parent had indicated previous dental or medical history in the new patient forms, the dentist would take note of that and alter their communication styles to best make that patient feel content. If pediatric dentists can understand their situation of their patients through the use of these written forms, they can successfully create a positive dental experience for that patient and their family. If parents inadequately complete these forms, however, it becomes increasingly more difficult for the dentist to use the proper communication specific to the circumstance. My research also found how different dental forms mediate action and conversation. Regarding new patient forms, the dentist can verify information verbally with the parent. By doing this, the dentists are showing that they care about the patients and want to give them the best experience by understanding their circumstances. For example, one of the questions on Dr. C's new patient forms is, how do you think your child will react to the visit? If that parent were to say that their child may react poorly, the dentist is likely to ask for more information to gain a deeper understanding. Regarding consent forms, however, parents are the ones that ask the questions. Since parents do not read these forms in their entirety, they always have questions regarding their child's treatment. The wording in consent forms may be intimidating for parents and may leave them feeling anxious. Because of this, the pediatric dentist will always verbally go over the consent form in a less intimidating way. Here, consent forms are shown to mediate conversation, which minimizes dental anxiety in both the patient and the parent. This also highlights the genre's capability to be mediated with verbal communication. The way the dentist explains the information makes for a completely different, more comfortable understanding. Considering all my findings, consent forms are the best example which highlight the written genre's capability to be mediated, meaningful conversation. Further, Dr. D explained how he alters the wording of consent forms by explaining the treatment as a story. While each of my participants agreed that written communication has its importance, they found verbal and nonverbal communication to be more useful when aiming to alleviate one's dental anxiety. This is because they require mediation by other forms of communication to become meaningful. As one of my subjects explained, it is not comforting to receive a stack of forms to fill out. Interaction and communication with the parent and the patient allow for them to feel less anxious. Further, verbal and written communication complement each other. For example, if parents don't understand something that the dentist said, they can refer back to the forms and vice versa. Overall, the findings of my research conclude that dentists must be aware of varying constraints and must be able to alter their communication methods based on them. Written forms are a great way to identify these constraints with pediatric patients if they are filled out correctly. While pediatric dentists want their patients to feel content in the dental setting, they also want them to feel safe and taken care of. Due to time constraints, I was only able to conduct 3 interviews. Research including more participants would be interesting and beneficial to this discussion. Further analysis on various dental forms would be useful, as well as research into why parents chose to not read forms. An incidental finding in my research was that each of the 3 participants attended the same dental school. It would be interesting to research how specific dental school and residency curricula impact values and ways of communicating. In my specific project, my subjects had similar answers, and I wonder if it had to do with their shared curriculum. This project was very beneficial to me as it allowed me to investigate a topic aligned with my career goals. I also learned about data collection and how to properly read and write an IMRAD article, while improving my public speaking and presentation skills. This will continue to benefit me as I continue to pursue dental school, where I will continue to read and engage in research. This project has allowed me to further develop my reflective writing skills so that I can understand where I started, where I am now, and how I got there.